causes anorexia nervosa? Anorexia nervosa is an eating disorder that causes people to obsess about their weight and the food they eat. People with anorexia nervosa attempt to maintain a weight that's far below normal for their age and height. To prevent weight gain or to continue losing weight, people with anorexia nervosa may starve themselves or exercise excessively. The causes of anorexia nervosa. The exact cause of anorexia nervosa is unknown. As with many diseases, it's probably a combination of biological, psychological, and environmental factors. Biological. There may be genetic changes that make some people more vulnerable to developing anorexia. However, it's not clear specifically how your genes could cause anorexia. It may be that some people have genetic tendency towards perfectionism, sensitivity, and perseverance. All traits associated with anorexia. There's also some evidence that serotonin, one of the brain chemicals involved in depression, may play a role in anorexia. Psychological. Some emotional characteristics may contribute to anorexia. Young women may have obsessive-compulsive personality traits that make it easier to stick to strict diets and forego food despite being hungry. They may have an extreme drive for perfectionism, which means they may never think they're thin enough. Environmental. Modern Western culture emphasizes thinness. The media are splashed with images of thin models and actors. Success and worth are often equated with being thin. Peer pressure may help fuel the desire to be thin, particularly among young girls. Physical anorexia symptoms. Physical signs and symptoms of anorexia include extreme weight loss, thin appearance, abnormal blood clots, abnormal blood count, fatigue, insomnia, dizziness or fainting, a bluish discoloration of the fingers, hair that thin, breaks, or falls out, soft, downy hair covering the body, absence of menstruation, constipation, dry skin, intolerance of cold, irregular heart rhythms, low blood pressure, dehydration, osteoporosis, swelling of arms or legs.
Emotional and behavioral anorexia symptoms include such as refusal to eat, denial of hunger, afraid of gaining weight, lying about how much food you eat, excessive exercise, flat mood or lack of emotion, social withdrawal, irritability, preoccupation with food, reduced interest in sex, depressed mood, possible use of laxatives, diets, or other herbal products. And there are some complications such as that can be extremely fatal. Death can be one of them. Anemia, heart problems such as valve prolapse, abnormal heart rhythms, and heart failure. There's also bone loss, increase of fracture later in life. In females, there could be an absence in period. In males, there could be a decrease of testosterone. And there's other problems in the gastrointestinal, such as constipation, bloating, or nausea. There's also electrolyte abnormalities, such as low blood potassium, sodium, and chloride. And there could also be kidney problems. People with anorexia can also have severe nerve damage, and some conditions that have been reported are seizures, distorted thinking, number or odd or nerve sensations in the hand or feet. And brain scans indicate that parts of the brain undergo structural changes to return to normal after weight gain, but some damage can be permanent.
Neural basis of impaired cognitive flexibility in patients with anorexia nervosa. The purpose of the study was to evaluate the brain activity of individuals with AN while performing a task requiring cognitive flexibility on the Wisconsin Card Sorting Test, WCST, which is one of the most frequently used neurocognitive measures of cognitive flexibility and problem-solving ability. Participants and methods. Participants. 48 right-handed women participated in the study. 21 individuals who fulfilled the DSM-4 criteria for AN were 11 ANR and 10 with ANPV were recruited from outpatient and inpatient at Tohoku University Hospital. Individuals with claustrophobia, visual impairment, including defect in color perception, metallic implant, lifetime presence of head trauma and or neurological diseases or life-threatening physical conditions, and those with past, present, active 1 or 2 psychiatric disorders were excluded. AN patients were depressive disorder, anxiety disorder, or personality disorder, which are highly prevalent comorbidities, and AN patients were included in this study to reflect typical clinical situations. Given that cognitive flexibility is impaired by major tranquilizers, patients who took major tranquilizers were excluded, with those who took SSRI were included because SRI minimally affects cognitive task performance. All controls were within the normal weight range of 18 to 23 kilograms. After many patients were excluded from various reasons, they were left with the following. Participants were 15 female AN patients, 15 age and intelligence quotient matched healthy control women. Participants completed the WCST while the brain activities were measured by functional magnetic resonance imaging during the task. Brain activity in response to set shifting, error feedback, and a correlation between such brain activity and set shifting performance were analyzed. Number 2, ethics statement. The study was approved by the ethics committee of the Tohoku University School of Medicine, and all participants provided written informed consent to participate. All participants were judged to have the ability to have consent through a medical interview. Number 3, psychological assessment. The 26-item eating attitudes test, EAT 26, was administered to all participants to evaluate their eating behavior and severity of eating disorder. Number 4, task. The WCST was administered in the same manner as in the fMRI study on patients with irritable bowel syndrome. Number 5, image accusation. There are images acquired on 1.5 T-Simon Megaton Symphony MRI scans using standard 2-channel head coil at Tadine McKee Hospital. 6, fMRI data analysis. Images processing and statistical analysis were performed using statistical parametric mapping. Number 7, statistical analysis. JMP Pro version 9 for statistical analysis for demographic and WCST task performance data was used. Results. Demographic data and behavioral results. There was no difference in age or IQ between a group. BMI was significantly lower in patients than in controls. Number 2, imaging results. Cluster of significant brain activations are shown in results. In the table, cerebral activations are not shown because activities in the cerebral cortical and subcortical regions in the focus of this study. Individual mean contrast value for right VLPFC activations on set shifting error feedback showed a positive correlation with correct rates in control, but not in AN patients.
Self-body image. I grew up with a grandmother who took diet pills her whole life and made sure that we didn't eat junk food because she would make comments about us getting fat. My mom struggled with her weight her whole life, up and down. I remember when I was growing up, she would lose 50 pounds, gain 100, lose 20, gain, 50. So it was really difficult growing up in that kind of environment. So I always was concerned about my weight. And it was about middle school is when I began to really, really care about it. I didn't eat. I would wear baggy clothes and sweatshirts, even during the summer, just to hide it. It was a weird feeling. And it was in high school that I started getting really bad. I had rituals where I would work out in the morning, work out at night, and I felt like my life was out of control, and the only part that I control is what I put into my mouth. So I didn't eat a lot, but I worked out too much. It was about my senior year that I actually fainted and needed to go see a doctor about it. I shortly after went to a therapist and began to understand and have more self-confidence and started to like myself more. it was, it wasn't an easy process. I still deal with it every now and then, but now I just try to control how I can eat healthy and how I can exercise and work out that's appropriate and not have to go overboard. It does hurt my brain. It did hurt my brain functioning. My grades would be good sometimes, but not be good others because I wouldn't be able to concentrate. I had problems like concentrating, memory. My mental flexibility was not good because I struggled so much with that being hungry. It was sad, and now I'm better. And yeah, everybody should help if they need it.
Hi, my name is Melissa Taylor. This is about my little story that I went through when it comes to anemic. I was in the 10th grade and I was dancing a lot and I was cheering, and I had my own little issues personally when it came to my social life type thing, I guess you could say at the time. And I was so busy focusing on other things that I wasn't focusing on myself and my own health. And so that's when I became anemic. I just didn't eat for months. Like literally probably about 6 months I didn't eat at all. And one day my mom looked at me and she said, "Missy, like something's wrong with you. Like you look so unhealthy." And I just kept saying like, no, I'm fine. Like, you just start to ignoring the situation. You see what's happening because you look at yourself every day in the mirror, but at one point you just ignore what's happening to you and yourself and what's going on with your body. And so I turned around and my mom's like, "Let me see your back." And that's the point, I think, that I realized that something's wrong with me and something has to change in my life, because obviously whatever I'm doing is affecting myself, and I was looking unhealthy. I went from a size 5 to a size 0 within instantly, and I just didn't want to eat. I wasn't hungry. I didn't like the way food looked. I didn't like the way of chewing food. Like it was just too much work. Like I couldn't take it any longer. So my mom turned me around and she said, "Missy, let me see your back." And so she lifted my shirt up and she could literally see each individual spine, like on my back. You could see my spinal cord completely. And I didn't even bend my back. Like I just literally kept straight and you could see the spine in my back. And so I went from a size 0 just instantly, just like that. And so that's when eventually I had to change my lifestyle, change the way my eating habits. Even though I still don't like eating as much food like that, I'll eat like snacks like Cheetos or something to help me change, because mentally it was messing me up to a point where I wasn't myself. I wasn't eating. Like, who goes from a point from eating all this food to just completely just cutting food out of your life completely? So I felt like that's kind of how it affected me, how anorexia kind of affected me in my life. And that's something that I feel like most females, more children, like kids that are younger females, are going through that type of situation, and it could be something that's going through way worse. But my situation, that's how I went through it, and that's how I'm kind of overcoming it now. I'm still like making myself eat more, even though I don't like eating, but I still have my, my friends and my family like forcing me, and my boyfriend forcing me to eat, because I just don't like to eat. And if I do eat, I'll eat like like I said, hot Cheetos or something, like coffee and a Danish or something. But that's literally what I eat. But at least I'm changing my ways now. And that was in 10th grade, and now I'm a senior in college. So it still kind of comes with me, but mentally I feel like I'm more energized, I'm more aware of things, and it's helping me become more prepared in life, I guess you could say. But yeah, thank you.